STEMI, ER room 2. Code STEMI, ER room 2.
Code STEMI? That's an ST segment elevated myocardial infarction. This person needs help and quick. I better go. Okay, bud, while you and the code team respond to that heart attack, I'm gonna help these future nurses get their license. And maybe on a code team with me not too long from now. Seriously. Now the reason that code was called overhead was probably because a patient showed up to the ER with chest pain, trouble breathing, had a sweat going and looking real bad. Or maybe just a little pain in her jaw. So how do we know that it's a myocardial infarction or a heart attack? Remember, infarction meaning tissue death due to blockage of blood flow, and myocardium meaning the heart's muscle tissue. So no blood is getting to some part of the heart, and that's a problem. So if a patient shows up to the ER with any indication they might be having a myocardial infarction, the ER doc is gonna order an electrocardiogram or an ECG or EKG. Same difference, they both mean electrocardiogram. The EKG is a paper printout of the electrical activity in different parts of the heart over the span of seconds. Now reading EKGs ain't easy, and that's the reason why doctors are the ones that say, call a code STEMI. Because they've had much more training in reading EKGs. And even then, they talk to our wonderful cardiologists that have had extensive training in reading electrocardiograms. Hey, heart doctor? This is the ER doctor. I've got a patient here whose EKG looks like a myocardial infarction, but you're the heart specialist. You tell me what you think. Now, just because we have our ER docs and hospitalists and cardiologists floating around the hospital doesn't mean we as nurses don't need to know what a heart attack looks like. Because it can strike at any moment. Picture yourself on a telemetry floor where all the patients are wearing cardiac monitors with their heart rhythm showing on a screen at all times. Your patient just finished their chocolate boost and pureed peas and they need to hit the commode and pronto. So you're in there with your gait belt, your air freshener, and your clothespin, helping them transfer from the bed to the commode. Suddenly they start clutching their chest and saying, "Oh boy, I feel weak. Oh, it hurts to breathe." You're gonna glance up at the cardiac monitor to see if there are any rhythm changes. And if there are, you've got some calls to make. Because remember, as nurses, we're the eyes, the ears, and the nose kept on the patients for the doctors when they can't be there, which is the majority of the time. So while they don't expect us to know a cardiologist level interpretation of an EKG, they do expect us to know the telltale signs of a major event, like a myocardial infarction. So that's why on the NCLEX, you're gonna see a question like this. The nurse is caring for a patient that suffered from a myocardial infarction. While monitoring the patient's EKG for signs of a myocardial infarction, the nurse may observe which of the following. Now I like to say I or you whenever I'm doing these questions, because it's going to be me or you in the scenario, right? Now I also like to de-robotize and rehumanize these questions, so they sound more real world and less like those well-rehearsed BLS video scenarios. Now I don't know if you're the type to say, "Doctor, while I was monitoring the patient's EKG, I observed signs that the patient might be suffering from a myocardial infarction." But that clearly ain't the way I talk, and that means it ain't the way I think. Then I'll remove redundancies and carefully rephrase it, so it's easier for my brain to compute. I'm caring for a patient that's had a myocardial infarction. What am I gonna see on the EKG that shows signs of an MI? That makes a lot more sense to me. And here are your select all that apply choices. I'll give you a few heartbeats to look them over. Alright, you got them all? Good. Now my doppelganger that ran off earlier, he gave you the first answer already, and that is ST elevation. ST elevation means the ST part or segment of the rhythm is elevated, hence the name STEMI. ST segment, elevated myocardial infarction. Now the ST elevation occurs when part of the heart ain't getting any blood, because one of the coronary arteries that supplies it is completely blocked off. And we all know what happens when tissue doesn't get any blood. It dies. Not good. Correct choice number 2 is pathologic Q wave. Now you might say, "Hey nurse Stefan, wait a minute, normal sinus rhythm has the Q wave. What gives?" And you betcha it does. And that's why Mother NCLEX threw in there that important word, pathologic. Pathologic Q wave means the wave was caused by a disease process. This one being caused by myocardial tissue death. Correct choice number 3 is T-wave inversions. This is yet another sign that could indicate myocardial injury or infarction. In this case, again, a full blockage of blood causing myocardial tissue death. So there are your 3 correct answers. Let's talk really quick about the 3 incorrect answers and why they're not correct on the test. The U waves are thought to be caused by repolarization of the Purkinje fibers or papillary muscles, which can be found in healthy patients but also may be a sign of electrolyte imbalances, not necessarily an MI. Incorrect choice number 2 is prolonged PR intervals, which means the slowing down of the signal between depolarization or firing of the atrium and depolarization or firing of the ventricle. We'll see these prolonged PR intervals in first-degree heart block. And the last incorrect answer is irregular PR intervals, which can be thought of as inconsistent lengths of the PR intervals. We'll see these irregular PR intervals in other types of heart block, like second and third degree heart blocks. So for the purpose of the NCLEX, you should be connecting myocardial infarction EKGs to ST elevation, pathologic Q waves, and inverted T waves. Now I remember this by saying, Steph's the key. Remembering that the Q and the T waves both have something unusual going on with them, and that mnemonic phrases aren't always true at 6 in the morning. They must be headed to the cath lab with that patient. While I go help, you keep studying so you can come join me. Because all of these patients, they need your help. Keep that in mind.